On the circulation of blood throughout the body of the opossum, I begin with a bit of an apology. Although it is said that mammals no longer possess a sinus venosus as adults, this undoubtedly is primarily based on placental mammal studies. I'm not sure how well marsupials are studied. And when I dissected the marsupial heart, this certainly seems to be a sinus venosus to me, that the two anterior vena cava or precava and the inferior vena cava empty into. And this seems to be the opening of the sinus venosus. But I could be wrong, and I was unable to find other scholarly articles or my comparative vertebrate anatomy textbook to back that up. From this possible sinus venosus, deoxygenated blood comes into the right atrium, into the right ventricle, and even primitive mammals have a complete interventricular septum separating the left and right parts of the heart. From there, deoxygenated blood is sent through the pulmonary trunk to pulmonary arteries and the lungs, where gas exchange occurs, and blood is returned through pulmonary veins to the left atrium, to the left ventricle, to the aorta. From the arch of the aorta, a single brachiocephalic trunk is the origin of both the right and left subclavian arteries going towards the arm and the right and left common carotid arteries going towards the brain. The common carotid will produce both the external carotid, which goes to the face, and the internal carotid, which goes to the brain. There are both external jugular veins draining much of the head and internal jugular veins. There is a curious venous circle from the external jugular that encircles the clavicle. These then empty into those anterior vena cava or precava, which empty into the right atrium. While most mammals possess a single superior vena cava, these opossums possess the more primitive trait seen in reptiles of having two. As in other mammals, the subclavian artery and vein form the axillary artery and vein, which form the brachial artery and vein in the arm, and the femoral and iliac vessels empty into the abdominal aorta on the arterial side and the inferior vena cava for the iliac veins.